It is a profound moral issue.
Senator Bernie Sanders of Vermont opening the Senate Health, Education, Labor, and Pensions Committee on Tuesday by pointing out that Americans could die if they cannot afford life-saving weight loss and diabetes drugs sold under the brand names Ozempic and Wegovy. Sanders questioned Lars Jorgensen, the CEO of the pharmaceutical company Novo Nordisk, on why Ozempic costs Americans nearly $1,000 for a month's supply, compared to about $60 in Germany.
The outrageously high cost of Ozempic, Wegovy, and other prescription drugs is directly related to the broken, dysfunctional, and cruel healthcare system in our country.
Jorgensen blamed pharmaceutical benefit managers, the companies negotiating prescription drug costs on behalf of health insurance plans. Jorgensen claimed that PBMs punish drug companies that reduce prices, since the reductions mean less money for the PBMs. Sanders said he had written confirmation that major pharmaceutical benefit managers would not limit coverage if the list price was reduced for Ozempic and Wegovy. Jorgensen seemed skeptical of the terms, but said he'd be happy to meet with them.
Do you have some suggestions to reduce these perverse incentives to deliver savings and value to the patients in need?
If we could stop linking their income to a list price, I think that would create an incentive that is not as absurd as it is today.
Senator Tammy Baldwin of Wisconsin brought up a different concern, asking Jorgensen if the company's focus on Ozempic and Wegovy will impact its ability to keep up with insulin needs.
You will continue to have a focus on providing critical insulin. You will not reduce your manufacturing capacity in that area.
We are committed to supply to the patient that has been using our insulin.
The Pharmaceutical Care Management Association issued a statement ahead of the hearing saying Big Pharma's favorite messaging tactic is pointing the finger and avoiding accountability. It added PBMs are engaged in the pressing work of helping patients, employers, and other health plan sponsors navigate the urgent challenge of the day posed by Big Pharma's egregious pricing of GLP-1 drugs for diabetes and weight loss. Jorgensen said a majority of Americans with insurance coverage pay $25 or less a month for the drugs, and that the company has programs to support patients who cannot afford them. In Washington, Charlotte Scott, Spectrum News.
Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.